My name is Tally, and happy Canada Day to all my fellow Canadians. And welcome back to Autism 30. To all my international listeners, I hope you're having a wonderful and celebratory day as well. It's been 3 months, but we're back and are starting our regular broadcast today. For those who haven't done so already, don't forget to subscribe to the Autism 30 podcast by visiting our webpage, autism30.com, and signing up. You can also reach us on iTunes, Facebook, Twitter, Google+, and YouTube. And when you're there, don't forget to write an iTunes review and like us. And of course, you can also visit us on the autism30.com webpage. To all of you who are new, don't forget to listen to the introduction podcast to understand the reason behind the creation of this new podcast. And to those who are returning listeners, welcome back. Now, get ready for our accomplished, inspiring, and informative guest to impart their wisdom in your ears. Get ready, and here we go.
I'm an autism awareness angel, making sure my wings protect the different, the stranger than. I'm an autism awareness angel. It's good, cause I'm cool with the unique behavior. I'm an autism awareness angel. Will you accept me? Cause I accept you. I'm an autism awareness angel, cause a view from the spectrum is a better point of view. The question at hand, are you aware of
I would like to introduce to you Dr. Chris Gibbins, psychologist with West Coast Child Development Group Incorporated, located in Vancouver, British Columbia. He has been working in the field since 2001, since completing his doctorate in psychology at Queen's University in Ontario. He was also awarded the prestigious Eleanor Ames Award and has won the Excellence in Education Award for innovative presentation of clinical rounds. He is also published in various papers and is a registrant of the College of Psychologists of British Columbia. We are very pleased to have him here speak with us today. Welcome, Dr. Gibbins.
Thanks for having me.
So, just to ask you, what are the early signs of autism?
Well, there's a number of things that can bring kids to our attention. One of the more classic ones that comes up commonly is kids who have a delay in their language development, especially kids who may not be speaking at the age of 2 or 3, or have started speaking but seem to be progressing very slowly. Particularly kids who do talk but don't seem to use their language to talk to people. So a kid who just kind of recites numbers or letters or lines that they've heard from TV shows, but doesn't try and communicate with their parents. We do see some kids, particularly kids who come in a bit older, who have quite good language development, and they're often coming to our attention because they've had difficulties being able to get along with kids, being able to adapt to preschool or elementary school, and kids with kind of an unusual behaviors that stand out and make them appear different from their kids that other people may think are kind of quirky or peculiar. Those are the major things that tend to bring kids to our attention.
Okay, what about the physical characteristics of autism? Do you see any of that, or?
In terms of sort of physical features, there's not necessarily a lot that's common to a lot of kids. There are a few particular things that are associated with higher risk kids who have an accelerated growth in head circumference, but those aren't too common. In terms of more physical behaviors, we certainly see kids who do kind of repetitive movements, who may be flapping their hands, flicking their fingers, sort of moving objects in and out of their peripheral vision. Particularly kids who are sort of out of infancy when we'd expect them to be doing more kind of imaginative play or social play, who seem to be really focused on either movements or use of objects that are kind of repetitive and rigid and don't involve other people, where you think, if it was me doing this, it might be fun for a minute or two if I was stressed out, but I would be bored of it after 5 or 10 minutes, and they're doing it for an hour. Those sometimes stick out for parents because they're sort of more unusual looking.
So if a parent notices these behaviors in their children and they suspect their child of having autism, can they book an appointment with you directly, or do they have to go through a family doctor or a pediatrician?
In BC, there's a couple of different alternatives. There is the publicly available assessment service called the BC Autism Assessment Network. And for that, they would need a referral typically from a pediatrician in most cases. And they would refer to BCAN at Sunny Hill, who would then arrange an assessment, usually local to the region of the province that they are in. And then that assessment would be done as part of the public system. So there's typically a waiting list of several months, but it's done at no cost to the family as a result. It's possible for parents to get the assessment privately as well. And according to the standards in BC, whether it's being done privately or publicly, it has to be done to the same standards. The requirements for what we do and how we do it are the same. But the trade-off, of course, if it's done privately, the waiting list is often shorter. The cost to parents is substantially higher, especially if they haven't had a speech and language assessment, which for kids under 6 we would also need. But in that case, if parents are willing to go the private route, then they can essentially self-refer, but they would still need to be seen by a pediatrician, a speech and language pathologist, and a psychologist if the child was under the age of 6.
So if a parent wants to come to your office for an autism diagnosis assessment for their child, what is the process?
There's a few things that we want to make sure that we do. We have some forms that we send out for parents and teachers to fill out if the child is in daycare or if they're in preschool. And then we book an appointment to come in and see the child and the parents at the office. It's a little bit of a different process for children who are under 6 versus over 6 because the protocol is different in BC depending on age. For the kids under 6, we need to do some psychological assessment looking at their kind of cognitive or intellectual development. We have some in-person assessment using the Autism Diagnostic Observation Schedule that's more of a play-based assessment looking at communication and social skills and behavior. And then we have a more detailed parent interview, the autism diagnostic interview that we go through with the parents that looks at the specific questions that we're interested in. For kids who are over 6, we only need to do the autism diagnostic observation schedule and the autism diagnostic interview. We don't need the cognitive assessment piece for older kids. And for older kids, we don't need a speech and language assessment, which we do need for kids under 6, whether it's done by one of the people who work with us or whether it's done by another private or public speech and language pathologist. And then we get all of that information, put it all together, try and get a sense of what the big picture is for the child. Do they fit overall with an autism spectrum diagnosis or with something else? Is there a better explanation than autism? And a fair proportion of the kids that we see do turn out to have some other condition other than autism. And then we try and be as clear as we can on what we think that might be. And then we have a feedback meeting with the parents after they've received the report to go over it and talk about recommendations and next steps and what they can be doing to help their child depending on what it is that we found.
And how long does the process take from start to finish?
Once I see the kid, the in-person part of the assessment with the child and the parents usually takes about 3 hours, so kind of a half day. For me personally, I try to get the report turned around within a week or two, and barring being on vacation or being particularly swamped, that's usually the timeline I try and hit. I can't vouch for absolutely everybody in the world who does it. That's the timeline, but that's what I try for. And then setting up the feedback meeting is more dependent on everybody's schedule. So the timing of that, it depends on when we can book it in. But usually we can get the report and the paperwork back to the family within a week or two, so that if they do have an autism diagnosis, they can go about applying for funding, communicating information to schools, and kind of get moving on the next steps, even if it may take a little while to schedule the feedback meeting.
So you brought up a good point about funding. When is funding actually entitled?
So the way it works in BC currently is that children with an autism diagnosis are entitled to funding administered by the Autism Funding Unit from the time at which the Ministry of Child and Family Development Office receives their application on a month-by-month basis. So if we see a kid on May 20th and then we get the report to the parents on May 27th, and they're able to drop off the report and the paperwork and all the documentation that we need on May 28th, and that child will receive funding for the month of May, and it's kind of allocated on a month-by-month basis. If they wait until June 1st to get the forms in, then they'll receive funding starting in June. So that does put a little bit of time pressure on us when it starts to roll towards the end of the month, because it makes a difference to families if we can get them the report 3 days before the end of the month or just after the end of the month. But that's the kind of funding timetable in BC.
You're very passionate about your job, but what do you like about it?
One of the things that really appeals to me about my job is the sense of detective work, that we're often seeing families who are confused or are uncertain what to be doing for their child. The things that they remember working well for them when they were growing up, or the things that have worked well for other children, don't seem to be getting the same results, and their child is doing things or developing in ways or acting in ways that are concerning to them and may be hard for them to understand. And from my own experiences as a parent, and from talking to hundreds and hundreds of parents over the years, I know that sense of uncertainty for parents is one of the really stressful things. When you don't know what's right for your child, you know there's some sort of problem, and you aren't sure what you should be doing, and you aren't sure where to get help. And I think my role in the process is to try and reduce and resolve that uncertainty as much as possible, and help point to a path forward where we can say that a child may have these particular issues, they may have different needs from other children, they may require a different kind of support. And for some of the kids that we see, the developmental pathway and the outcomes long term may be different from what parents have expected. But we can help put them on a road where they can feel like they're doing the right thing, they're taking action, they're getting support, they're being given tools to help improve their child's life. And being able to kind of move parents from that sense of doubt and uncertainty and often guilt to a sense of being in control and having tools, and not having all the answers certainly, but having a way forward where they can really go to work to give their child the best support they can, is really satisfying. And I think that's one of the strongest impressions I've had over the years, is that there's a lot of value in just helping a parent really understand and get to know better how their child's mind is working, and how they're learning, and what can help them to move forward. And there isn't anything that is scarier to deal with than the unknown. So even when we're giving parents news that they might not have been hoping for when they were initially finding out they're going to have a child, I think moving from that state of uncertainty and fear to a sense of having a plan and having a way to go can sometimes be really transformative. And I'm kind of happy to be able to play that role in that process.
Thank you. Now, a question I'll ask everyone, and with your experience about working with people with autism, what is the one thing that you would like the world to know about autism?
I think that there are a couple of things that are really important to understand about autism that I think are probably related. I think people with autism have been misunderstood for a long time. This is a condition that we've kind of known about and described for decades and decades and decades, but really I think fundamentally misunderstood for a lot of that time. One of the sort of stereotypes that I think gets put on people with autism a lot of the time that I don't think is accurate the way it's often described is that there's a problem with empathy and with their ability to kind of feel connections to other people. And this kind of even goes back to the old Freudian descriptions of autism as being kind of a disturbance of the relationship between mothers and children, and the tendency we often have as a culture to just find some way to blame everything on mothers, no matter what it is. Somehow it always ends up being turned into mother's fault somehow. Even though in my experience, many of the things we have to deal with are not things that parents really chose to do or could have chosen to avoid for their kids. So I think kids with autism, they have difficulty reading social cues. They have difficulty catching the signals that other people are sending them to try and let them know how they're feeling. But I think it's more of a difficulty in knowing how to see those cues and how to understand them. It's not a problem of the feelings of empathy and the feelings of connection with other people. I meet some kids with quite severe autism, kids who are virtually uncommunicative in any sort of traditional sense, where it's obvious from just looking at them that they're strongly connected to their parents. They don't relate to their parents the same way as they relate to me or a stranger at all, even if they don't communicate that in the way that most kids do. And similarly, I see lots of kids with autism who are able to express really strong senses of compassion and concern, and concern for justice and concern for people they feel are suffering in some way. But it's hard for them to know what to do about that, and it's hard for all of us to know sometimes what to do about that. But how do you express that, and how do you communicate that in a way that somebody else is expecting and will understand? So I think with kids with autism, there's a problem of perception. Just if I wasn't wearing my glasses, there's all sorts of things I couldn't perceive and respond to the way people would like me to. There's a problem of expression and getting what's inside their minds and their feelings out in a way that we all understand it accurately. But the idea that there's a deficiency in that fundamental sense of compassion and connection and desire to have a relationship with other people, I think that's mistaken. I think it's more challenging for them, often much more challenging with peers, and kids get discouraged and come to the conclusion sometimes that's very difficult for them to do and maybe not worth the effort. But I rarely see a kid where I can't point to an important relationship in their lives that's really significant and meaningful and deep for them, and that they're communicating in some way that person is of critical importance to them. And I think that's a good message for parents to understand, even if they may not be saying the things that we all dream about, that our kids will wake up every morning and say, gosh, I love you, Mom and Dad, you're the best parents ever. That doesn't mean those feelings aren't there, just as when my daughter wakes up and says, oh, let me sleep, go away. It doesn't mean that she doesn't care about me at all either.
I want to thank you for your time and sharing your knowledge with us, Dr. Gibbins. If you'd like to contact Dr. Gibbins, you can find all of his contact details on our webpage, autism30.com. Also, don't forget to check out Greg Milk's music on iTunes. Thank you for joining us, and until next time, this is Tally telling you to live in love.
Hey yo, I'm an autism awareness angel, making sure my wings protect the different, the stranger than